Well, good morning and welcome everyone. It's Wednesday, the 18th of March. Now, I've been anticipating, indeed predicting this pandemic since January now, really. And it's very sad to see that it is now patently coming about and affecting all life. But I'd like to reassure people that this will be temporary. I believe things can go back to normal after this, and hopefully valuable lessons will be learned. Now, I'm not normally in the prediction business, but I'm going to make a prediction for December 2020. And my prediction for December 2020 is that there's going to be a lot of babies born at that time. Because all over Europe, especially at the moment, people are closed in their own homes. Perhaps not too much to do, and that there may be opportunities taken for couples to have quality time together. So it wouldn't surprise me at all if there's a massive increase in the birth rate next December. Now, I keep getting asked about the Olympics, and I predicted about 6 weeks ago that the Olympics probably wouldn't be going ahead, and that is still my position. Let's hope I'm wrong, but they start on the 24th of July, so it doesn't really look like it. Now, I'm getting asked all the time, virtually every day, I get lots and lots of emails and lots of comments. How do I boost my immune system? People are asking, how do I increase my immunity to reduce my chances of getting the COVID-19 virus or of getting it less severely? And as I understand it, I don't know of any way to boost your immune system, but I do know of lots of ways to make it worse. So the human immune system is quite an amazing thing. It can recognise something like 9 billion foreign antigens, things that the body would recognise as foreign bacteria and viruses. Quite an amazing system. And I don't know of a way to boost it, but I know of plenty of ways to make it work less optimally, to reduce the efficiency of it. But of course, remember, this COVID-19 is a novel virus. It hasn't been seen before. So the immune system is not going to recognise it, and it's going to have to start making its antibodies. It's going to have to start the immunological process from scratch. So how do I get my immune system to be as good as it can be is the real question. So you can't boost immunity, but you can make it worse. So how do we make it as good as we can make it? Well, the first thing is make sure you get plenty of sleep. Lack of sleep will reduce immunity. So good sleep is important. The second point is make sure you are well nourished. Now, people talk about taking lots of this nutrient or lots of that nutrient or eating lots of that to give protective effects, and the evidence for that really is not strong, if it's there at all. So I would say get plenty of good nutrition. So we want lots of plant products, lots of flavonoids. Flavonoids are in the coloured components of plants. So lots of fresh nutrients, as much as lots of fresh fruit and vegetables. Enough protein. We don't need to eat masses of protein. We don't need huge amounts of protein, but we need enough protein. Now, the nutrient that we're often short of in the northern hemispheres is vitamin D. So I'm currently taking a vitamin D supplement. That's the only supplement I'm taking at the moment, just vitamin D, because that's the only one I'm likely to be short of. So by taking huge amounts of extra nutrients, I'm not going to boost my immune system, but by being low on any nutrient, I can reduce the efficiency of my immune system. And because there's no sunshine over English winters, I take vitamin D because my skin won't make it. And we know that vitamin D deficiency is associated with immune deficiency. So nutrition is one thing, but no evidence for these fads that you should eat lots and lots of garlic or lots and lots of vitamin C. Don't be short of these things. I mean, garlic's good for you anyway, and it's got plant flavonoids and nutrients in it, so it's good. But taking huge amounts of it, as I understand it, will not boost the immune system, because I don't think it's possible to boost the immune system. It's only possible to keep it working at its normal, healthy, optimum level. Now, psychological stress can reduce immune function, so try and reduce your stress. That's a ludicrous thing to say. I'm not quite sure how you do that. But try and reduce stress as much as you can. Socialising and sharing things is probably one of the best ways to do that. Do keep fit if you can. Exercise is good. Regular exercise is good, because these things optimise health, and if you optimise health, you're likely to optimise immunity. Get plenty of fresh air. Good ventilation, I think, is important. Now, optimise your health generally. So be as healthy as you can. So if you're a bit overweight, lose weight. If you smoke, stop smoking. If your diet's junk food, eat good quality food. Just optimize your health as much as you can, because the immune system is never going to work better than it is in a completely healthy human being. So optimize your health as much as you can. Losing weight can be quite important. So really good time to cut down on the sugars, cut down on refined carbohydrates, and eat good food. Cut out the junk food and eat good food. Lose the weight. Manage diseases. Now this is an important one. Comorbidities and pre-existing diseases need to be managed as well as possible. And this is part of optimizing health, really. So if you have diabetes, make sure your sugars are well controlled. If you have chronic obstructive pulmonary disease, make sure that you haven't got other bacterial infections and try not to make the condition any worse. So optimizing disease conditions. Now, people are always asking me about medications. And you have to talk to your own doctor about medications to optimize your disease state to get it as well managed as you possibly can. So don't stop taking drugs. Just talk to your own doctor about this. For example, if people are taking steroid medications like prednisolone and they stop taking them all of a sudden, then that can be quite serious. They can become quite seriously ill. So get onto your doctor. It might be difficult to get a face-to-face consultation, but telephone consultations you can usually get, and ask him how to manage your personal medications to optimize your personal health. And if you optimize your health, your immune system is going to be as good as it can be. And that's really all I can say about optimizing health. So let's just have a quick look at these. Optimizing health and optimizing the immune system. So just bear in mind there could be an increase in the amount of babies born in December 2020. Big sporting events aren't going to go ahead. I think about 6 weeks ago I said, let me rephrase the question about are the Olympics going ahead. Do we want people from infected countries travelling on aeroplanes to another infected country? That was the answer to the question, and clearly it's not going to happen in July, as far as I know, because this epidemic's probably going to peak over the next few months, and it's still going to be with us in July. So, yeah, so that's now the immune boosting. So we can't boost immunity. It's already absolutely brilliant. You can't make it better. But these things are all important factors, managing diseases and medications. Now, I have done some videos about fever, looking at fever as a natural adaptive response, and I have done a video about French recommendations and other recommendations we're going to look at in more detail about not taking ibuprofen if you have COVID-19. There's still a debate about this, but personally, let me just say I would not take ibuprofen if I have the disease. So I think I'll just post that as a short video now, and then we'll look at some disease from various places around the world and what that can tell us about the anticipated ongoing course of this pandemic and how it's going to affect us all in the next months.